Welcome back to Medicare Mondays. Today's session is being pre-recorded. Today's session is about the premium-related appeals and troubleshooting those appeals. Let's first start off by talking about the income-related monthly adjusted amount, IRMAs for short. The Medicare IRMAs is an amount you may owe in additional to your Part B and Part D premium if your income is above a certain level. Federal law sets income brackets that determine your or you and your spouse's IRMA each year. This year, in 2025, individuals or couples that have income below $212,000 will not have an IRMA. However, if you have income above these thresholds, you will have an income-related monthly adjustment amount, which is an IRMA. For example, if you're single and you make more than $106,001, you would have to pay an additional amount to the standard Medicare premium of $185. That would be $259. This would go same for the Medicare Part D premium. Let's talk about requesting a new IRMA determination. If Social Security determines that you should pay an IRMA, they will mail you a notice called an initial determination. You can request that Social Security revisits this decision if you have experienced a life-changing event that caused an income decrease, or if you think the income information Social Security used to determine your IRMA was incorrect or outdated. Social Security considers any of the following situations to be life-changing events: a death of a spouse, marriage, a divorce or an annulment, you or your spouse stop working or reduce the number of hours you work, involuntary loss of income-producing property due to a natural disaster, disease, fraud, or other circumstances, loss of a pension, or receipt of a settlement payment from a current or former employer due to the employer's closure or bankruptcy. To request an initial determination review, submit a Medicare IRMA life-changing event form, which can be found at www.ssa.gov, or schedule an appointment with your local Social Security office. You will need to provide documentation of either your correct information or of the life-changing event that caused your income to decrease. Medicare Part B late enrollment penalty. Yes, Medicare Part B does come with a penalty if you do not sign up for Medicare when you are first eligible at age 65. You will usually owe 10% more for Part B, generally every year for as long as you have Medicare. Everyone has a right to file an appeal with Social Security Administration, regardless of their LEP. To appeal, follow the directions on the letter informing you about the penalty. Unfortunately, being unaware of the requirements to enroll into Part B is unlikely to be a successful argument for an appeal. Let's talk a little bit about how to calculate your Part B LEP. Let's say you delay enrolling into Medicare Part B for 7 years and you owe a premium penalty. Your monthly premium would be 70% higher for as long as you have Medicare, 7 years times 10%. Since the base Part B premium in 2025 is $185 per month. Your monthly premium with the penalty would be $314.50. You would generally calculate $185 times 1.7. Medicare Part B late enrollment penalty appeals process. Everyone has a right to file an appeal with the SSA regarding their LEP. To appeal, follow the instructions on the letter informing you about the penalty. The form can be located at ssa.gov. It is called the Request for Reconsideration form. The following reasons to appeal that may result in either the elimination or reduction of your penalty are: you have a job-based insurance some or all the time in question. The form you need is called an L564 form. That also can be located on the ssa.gov site. You were enrolled into Medicare Part B during some or all of the period in question. You can include proof of that coverage, including Medicare summary notices showing payment for care, statements showing premiums paid, or other records. You may have a new enrollment period, which is called a special enrollment period, where you were on Medicare before you turned 65, and now that you're turning 65, you can have that penalty erased. Or you were enrolled into the Medicare Summary Premium Payment Program. It's in the state where you live in, and the state pays for Part A or B or both. Now let's move on to the Part D late enrollment penalty. For each month you delay enrollment into Part D, you will have to owe a 1% penalty every month that you go without Part D. The Part D penalty is always calculated using the national base premium. Your penalty will not decrease if you enroll into Part D plan with a lower premium. Anyone has the right to file an appeal with C2C Innovation Solutions, that's Coverage to Care Innovative Solutions, regarding their late enrollment penalty determination, which is the company contracted by Medicare to handle these appeals. You should complete the appeal form you receive from your plan, attach any evidence you have, and mail everything to C2C Innovation Solutions. Let's look at a little example on how to calculate your Part D late enrollment penalty. Let's say you delayed enrollment for Part D for 7 months, and you didn't have other credible coverage, which allows you to delay enrollment. Your monthly premium would be 7% higher for as long as you have Part D. So the calculation would be 7 months times 1%. The national base beneficiary premium in 2025 is $36.78. So your monthly premium would have an additional $2.57 added onto that premium per month, which you would pay in addition to your month's premium. Other ways that you could find relief in late enrollment penalties or appeals would be equitable relief. Equitable relief is a process that allows you to request the following from Social Security Administration: immediate or retroactive Medicare enrollment, elimination of the Medicare Part B late enrollment penalty. To request equitable relief, you must have failed to enroll into Medicare due to an error, misrepresentation, or inaction of a federal employee, such as Social Security or Medicare 1-800 Medicare representative. Equitable relief does not apply if you were misinformed about your Medicare rights and options by non-federal employees, such as an employer. To request equitable relief, you and your representative should write a letter to your Social Security local office explaining that you received misinformation that caused you to delay enrollment. You can find the address of your local Social Security office by calling 1-800-772-1213 or by visiting www.ssa.gov. Other ways that you could possibly use for a late enrollment penalty appeals would be using the Medicare Savings Program. Medicare Savings Program helps pay your Medicare cost if you have limited income and savings. Additional benefits of enrolling into the Medicare Savings Program include allowing you to enroll into Medicare Part B outside of the usual enrollment periods, or eliminating your Part B late enrollment penalty if you have one. The MSP has income and asset limits which vary by each state. Contact your local Medicaid office or your state health insurance program for more information about the MSP in your state and for help applying. Rhode Island SHIP is 1-888-884-8721. Another program that could help you erase or appeal a Part D penalty is using the Extra Help. Extra Help is a federal program that helps pay for some or most of the out-of-pocket costs of Medicare prescription drug coverage. It is also known as the Part D Low Income Subsidy, otherwise known as LIS. The Extra Help program offers the following benefits. It pays for your Part D premium up to the state's specific benchmark amount, lowers the cost of your prescription drugs, gives you a special enrollment period once per month to enroll into a standalone Part D plan or to switch between standalone Part D plans. It also eliminates any Part D late enrollment penalty you may have. You will not have a Part D late enrollment penalty even if you later lose Extra Help eligibility. If your monthly income and assets are within specific limits, you may be eligible for Extra Help, even if your income or assets are above the eligibility limits. You could still qualify for Extra Help because certain types of income and assets may not be counted. To apply for Extra Help, call your local Social Security Administration or the main number at 1-800-772-1213. You could also complete an Extra Help application online by going to www.ssa.gov Medicare Part D Extra Help. Let's talk a little bit about exceptional circumstances. It is usually best to enroll into Medicare when you are first eligible or after losing insurance based on current work. If you miss a first-time enrollment period, there are certain times when you might qualify for exceptional circumstances, special enrollment period. An exceptional circumstance is based on that is unusual or not typical. The following are different types when you may qualify for a special enrollment period to enroll into Medicare Part B and Premium Part A without penalty. 1, you are impacted by an emergency or disaster. 2, you got certain types of misinformation from your employer. You are released from incarceration. Your Medicaid coverage is ending, or you experience other exceptional circumstances. These SEPs apply to anyone who missed initial enrollment after January 1st, 2023. To use these SEPs, submit a form CMS 1079-7 to the Social Security Administration or your local Social Security office. How can we identify billing errors? Healthcare providers and their billing departments sometimes make billing errors or honest mistakes. If you think your doctor or their billing department made an error or a mistake, contact them directly to resolve the issue. They should correct these errors if you tell them. You can spot these errors by keeping an appointment calendar or using a My Healthcare tracker to keep track of your medical appointments and services. You can call your local Senior Medicare Patrol office for a My Healthcare tracker if you don't already use one. The tracker can help you compare your appointments, services, and notes to your Medicare statement. If something does not seem right on your Medicare statement, remember to first call your provider. Here are some couple examples of potential errors. Your provider bills Medicare for an office visit on a day that they did not see you, or your provider billed you for services that were different than what you received. Contact your local Senior Medicare Patrol office. They can assist to try and resolve the error. Your SMP can also help you identify Medicare potential fraud or abuse and can help you report it to the CMS or correct authorities. Rhode Island's SMP is 1-888-884-8721. Should you need further help, we have several agencies that offer help. One is Aging Well. We have Johnston Senior Center. We have the West Bay Community Action Agency. We have the South Kingstown Senior Center. We have the Westerly Senior Center. We have the Point, our Aging and Disability Resource Center. We have East Bay Community Action Agency, Leon Matthews Senior Center, Progresso Latino, Child and Family Services of Newport County, Edward King House, and of course the main Rhode Island SHIP and SMP. Thank you for viewing our video. Please feel free to contact us if you have any questions. My name is Kim Timpson. I am the Health Insurance Coordinator, along with my colleague Jennifer Riaz, who is the SHIP and SMP Volunteer Coordinator. Have a nice day.